Welcome to the Bill and Kelly Show. Our guest today is Erica Hornthal. She is a dance movement therapist with the Chicago Dance Therapy. Welcome to our show.
Thanks for having me. Good to be here.
Well, we appreciate you coming on. And first of all, we'd like to find out is a bit about you, where you're from, where you're born and raised, and how you got into dance therapy.
So, I was originally born and raised in New Jersey, a little town in central Jersey called Edison. And
Know where that?
yeah, so I lived there only till I was about 10. I actually moved to Tampa, Florida after that. And then I've been in Chicago since about 1998. And ended up going to college in Illinois. And how I got into dance therapy was, well, I've been a dancer just as a hobby, really, my whole life. Started dancing when I was 3 or 4, and thought that I would make a career out of it, but knew deep down that I really wasn't talented enough to be a performer or to be a professional dancer to make a career out of it. And it was a college counselor that advised me about the profession of dance therapy. And she said, I see you have a passion for helping people. You're currently taking psychology classes. You're still on the dance major track. What if you combined your love for both? And I didn't know what that was going to look like, but I went onto the internet, found the American Dance Therapy Association, and honestly, I never looked back. So I graduated with my bachelor's in psychology. I went on to get my master's in dance movement therapy and counseling from Columbia College in Chicago. And as I was in school, I just always knew that I wanted to be a private practitioner. Again, I didn't know what that was going to look like, but almost 10 years into getting all of my licensure and credentialing, decided to become an entrepreneur. And I'm the CEO now of Chicago Dance Therapy. We're 9 years old, so who knew?
That's
Awesome.
wonderful.
Awesome. So tell us a bit about your clients. What type of people need dance therapy, and describe what your practice is like.
Sure. So honestly, everybody needs dance therapy because it's about movement. Everybody's moving. We're moving all the time. I think now in this strange pandemic, we're realizing how much we move because our movements are limited. And that's why it's playing a role on this kind of the second pandemic, which we're talking about mental health. So, I think everybody can benefit from it. When you take the word dance away and you just focus on the word movement, you realize that it's applicable and accessible for everybody. So, our clients, while some of them are specifically people that need movement to express themselves because they have a movement condition or a cognitive concern, a lot of our clients are just everyday people who are realizing that talk therapy has hit a plateau for them, or that they can't really explain why they do what they do or how they feel what they're feeling. But the minute you get them in their bodies and the body starts to do the talking, a light bulb goes on.
Hmm.
And things that they've been suffering from for years suddenly come to the surface and can either be managed or sometimes completely released.
So this is interesting. You get involved with them on both a physical and psychological level. And so once they go through this therapy, you're there to offer them counseling. This is completely different for Kelly and myself because usually, in Kelly's opinion, is anyone that sees us dance may need therapy. So
That's okay too.
yeah, and she avoids dancing with me at all costs. And so she was worried about this whole show today that we were going to have to dance, which was not, in her eyes, is not a good thing. So yeah. So, but yeah, but so this is very intriguing. So, and really, and what a lot of doctors are saying during this pandemic as well is urging people to get out and move. Don't sit inside and binge. Get out and move. Obviously, be safe about your movement. And
Right.
but this is, creating a mental healthiness out of physical movement. So,
Mhm.
so describe some beside. Is there any like people that are mentally challenged or have some other deficit that you help with? That they have maybe not psychological, maybe just physical.
That's a good question. I mean, I feel like there's always a psychological component just because as we're talking, how important movement is, if you have a physical condition and your movement is impacted, then there is a direct correlation to your mental health. So, um, the mind body connection, I always feel like, and as a dance therapist, we feel like it's together, it's connected. So we can't really piece out one over the other. But I have had people come and say, I suffered a really bad injury or I was in a horrible car accident and it left me with these physical ailments or the inability to move part of my body. I work a lot with people that have stroke or have suffered a stroke, people that have Parkinson's. So anytime our movement is affected, we look at it at this, well, how can we improve your mental health or how can we maintain this mental health space that you're in if it currently is in a good place? Because some of our clients have degenerative illnesses that are only going to get worse, like dementia,
Mm,
Alzheimer's, again, Parkinson's, traumatic brain injuries, whether you're born with it or you acquire it, it affects the whole person, mind, body, and spirit. So the only time that I've turned away people is if they come to us and there clearly is only a physical component. Like, I've got arthritis in my back, or I have really bad knees because I've been a runner for 15 years. And I'll say, does it affect your daily way of living? Is it affecting your mood? Are you depressed because of it? Are you anxious? And if the answer to most of those or all of those is no, I'm happy, I'm healthy, I've adjusted, I just have pain and I want to get rid of it, then they really want to see a physical therapist or an occupational therapist, or a pain management physician. Because again, we don't provide exercises or movement that necessarily combat physical alone. There's going to be a mental health component to it. And if the person doesn't need that or isn't open to talking about how it's impacting their mental health, then it's not necessary in that capacity, if that makes sense.
right. Yeah, no, definitely. So describe for us about in before this new norm, if you will.
Mm.
What type of environment did you have to offer these services to your clients?
So typically three different environments. We have an office slash studio. We kind of call it both, depending on, like, I guess the client or who's talking about it. So it's a office setting with a little bit of movement space. We provide in-home therapy, so often to our clients who cannot leave their home, which is everybody right now. But whether you're bed bound, chair bound, again, a lot of my clients who have moderate to severe Alzheimer's disease were not leaving their home, so I would go to them. And then we have our healthcare settings, our facilities, our adult day centers, hospitals, that we were providing community support to.
All right. And so now come the pandemic, which has created a flattening of the world for everybody. And so, how has that? Can you describe for us how has that impacted you, and what services can you still provide through like Zoom and remotely, and maybe not even remotely through another clinician?
Yeah. So first and foremost, it affected me on a personal level. I have two kids, one of which is a 3 month old. So being home with an infant and a school aged child, trying to work, but also coexisting in our house all the time,
Hmm.
teaching, right? Because now we have this e-learning thing that's happening. It's a struggle. It definitely is. And I almost had to allow myself to let go of one to be in the other because balancing all of that just isn't always possible. You have to make things priorities. So that was difficult, just personally. Professionally, all of our face-to-face in-person sessions have become telehealth or over the phone. Um, and while clients have had wonderful response to it and their understanding of it, it's better than not having any mental health support at all. It has been a challenge because we've all built this rapport around a holistic approach where we can be in our bodies when our minds aren't right where we need them, or we can express ourselves through some movement if the words just aren't accessible. So if I'm on the phone, I can't see what my client's doing. I can ask them, or I can say, "Can you try this? Let me know what's going on," or tell me what's happening. We do use Zoom a lot, or not Zoom. We use like a HIPAA compliant, mental health portal. But it's basically like Zoom. And that's better because they can see me, I can see them. But there's a level of distraction. We're watching ourselves on the video while trying to, be with the therapist or be with the client. Um, there was an article posted, I think on CNN not that long ago, about how being on Zoom, being on a video platform, there's a huge dissonance between mind and body. The mind says that you're with the person, but the body doesn't, because I'm sitting alone right now in my room. So
Right.
it's very exhausting, it's challenging, and we just have to be realistic with those challenges as they come into the therapeutic relationship.
Yeah. And actually, Kelly and I talk more when we have shows than we do in real life. Yeah. That's our new norm. Oh well, such is life,
Well, it
right?
also depends. I mean, I have to say it depends on what you're used to, right? If
Yeah.
you're used to a relationship where you're spread apart and how you talk to each other is through, video communication. I have friends halfway across the world. That's how we talk. But when you're used to seeing people every day, and you're expressing yourself through like gesture, posture, using your hands, it's so different to have all of your interactions through a screen.
Right. Right.
Right.
Yeah. No. So yeah, it's been interesting. I'm because in fact, gosh, what I was listening to a podcast that NPR now is finding these intriguing shows. And I was
Mm-hmm.
listening to this podcast this weekend where the host said his life is now centered around his podcast because virtually there's nothing else he can do. And,
Yeah.
I think Kelly sometimes, and I do too, think, yeah, I mean, sometimes our show, especially last week, oh my gosh, it was our life. I mean, we had like 7 shows or something like that.
Right.
But yeah, I mean that becomes your interaction, and I know as human beings we genetically are designed to have in person to person contact, and I can't imagine some of the deficits that people like you are going to be needed after this is done. Because the deficits people are going to have, and I hear about the next step, which is the fear of going out. After
Right.
this is done, how many people are going to be afraid to go out? And so there's a lot of things that we're going to be faced to deal with as a society. So,
Mm.
what does this look for? I mean, have you looked into the future and kind of like maybe developed a plan for when this is all over? I mean,
I
obviously
think
you're
you're
going
going to be very busy when this is
to,
over because I
yeah, I
think a lot of
imagine.
That's what
people with
everybody.
their
I know that's what
anxiety and
people keep
everything are just going
saying.
to want to feel that freedom of movement and
Hmm.
Right.
everything.
And oddly enough, I have clients who already were, I guess there was some hesitation in socializing, right? There's social anxiety, or they get really anxious in social situations, or we may have people that are agoraphobic. And oddly enough, being forced to stay at home doesn't actually make them feel any better. It's like those issues are still there just
Hmm.
because we're not having to socialize or we're not
Right.
allowed to. It still brings up concerns. And, some people are finding this is an easier time, but other people, certainly aren't. So, yes, like you said, I think it's interesting that therapists and the mental health community is like, well, we're here. Like people are going to need us, maybe more so than anybody has ever needed us in the past.
Absolutely.
Right.
And I hope people just understand and let themselves ask for help, because that's always been the problem, right? There's a stigma. But if everybody needs mental health, if everyone's looking for therapy, maybe it'll break the stigma. Who knows?
Yeah. So let's talk about when things do get back to normal,
Yeah,
and we hope they do
The new
because,
normal.
gosh, yes,
I
what
hope
is
that
the
is.
new norm? And no one, we've even have psychologists trying to guess what that's going to be like, along with the physicians and PhDs who are trying to analyze when it's going to be safe. What do you view as the new world for you? Once this gets out? I mean, hopefully you're not going to get hit with the floodgates, but hopefully this is going to get you back to where you can sustain a practice again, your dream, really,
Yeah.
So what do you envision?
Yeah, I mean, I envision slowly returning back to a face-to-face, more personalized sessions. Um, for me, a lot of it is about the environment, and it really depends on where your stressor is. So for some clients whose stressors are in the home, it's so important that they get out of the home so that they can at least have the freedom to talk about what's going on, or they can, be able to be with or sit in the body when it's not necessarily consumed by the traumatic environment. So I definitely see being able to meet face to face. Honestly, some of the things that people have suggested are things that we've already been able to do. Some people are talking about, well, if it's a nice day and we know that there's, not a lot of people around, or we can make sure that it's again, like kind of a HIPAA compliance, a very confidential space. We can meet outside. We can maintain 6-foot distancing if needed. We already always had hand sanitizer and Clorox wipes in our office, just because so many people are coming in and out. People have colds and germs, and it's just a sanitary way to deal with things. So I don't think all that much is going to change after the fact, like you said, except for the fact that we may be pretty busy. I mean, we always had a nice influx of clientele, but I think now people are really starting to understand how beneficial movement is. And when our movement has been impacted so, I don't know, negatively for several months, it's going to be hard to get back into our old movement habits. And I think the best way to do that is meeting with someone who can help you get back to whatever your normal was.
Yeah. So as they say, open up the economy and people are able to go back and do things, and you view in the governor's order is, therapy is an essential part of, health, and people go back. So you view like face mask, and as you already said, social distancing is not going to be an issue, and it's going to be more of that HIPAA compliance and making sure you have a space to deal with them. But really, it sounds like you're prepared. It sounds like you're all ready to go once this happens.
Yeah, I think so. I mean, I'm in a or I say we, like, because it's not just me. I have a couple other therapists that see clients as well. I think we're in a fortunate space where we're already very aware of the body, right? We notice when people aren't feeling their best, or if somebody's sniffling, coughing, sneezing. I think, and being therapists, we're already so open with our clients, and we already have these dialogues where people are getting, for the most part, vulnerable, right? They're telling us very deep, private parts of their lives if they're willing to. It's okay for us to ask questions, like, hey, we're supposed to meet today. Here's a reminder. Let me ask you a few questions to make sure you're doing okay and you're feeling okay. Have you, like things at the doctor, like I went to take my son to the doctor, and the doctor had to ask these questions before we came in. Do you have a fever? Are you currently coughing? Have you traveled anywhere that the virus has been spread? And if you can answer no to all of those, then chances are it's safe enough to meet. And then, again, just practicing good hygiene and distancing if and when necessary. Just because we're moving or dancing together doesn't actually mean we are touching. It doesn't mean we're always right next to each other. It's giving somebody the space for them to be in their own body. And so sometimes I'm halfway across the room just witnessing them. It's also making sure that our office setting, because we're in a suite, that they're practicing good hygiene too. And if we feel like it's safe enough in that building for our clients to come back and they're willing to, then absolutely we'll look to reopen. But I certainly don't want to rush it. And knowing that my clients already have certain levels of anxiety, we don't want to exacerbate that. We really just want to meet them where they are. So for me, it's about asking them when they're ready. If you want to keep meeting on telehealth, I'm totally fine with that. Unfortunately, it also comes down to how long the insurance companies will cover telehealth.
Right.
I'd love for it to be permanent, but I don't know that that's going to happen.
Yeah. Oh gosh, I didn't even think about that too.
Yeah.
I have to ask
People
you
are saying as soon as like the shelter in place lifts, that some insurance companies may lift that policy. I
Right.
don't know. I'm just kind of taking it as it comes. So,
Eric, I'd have to ask you this because I saw a part of a YouTube that went viral about this guy dancing with himself in a mirror. Literally, he was holding hands.
Oh, yeah.
You saw that? Is that one of your clients by chance?
No, maybe after this. No, but you bring up a good point, because when I saw that video, I thought, that's actually one of the techniques, not using a mirror per se, but one of the techniques that a lot of somatic practitioners or dance therapists in particular use is this idea of mirroring. We want to be seen and we need to be seen. And although it's very vulnerable, there was something about that that I thought, oh, this guy is meeting a very inherent part of him that wants to move collectively, wants to be seen by someone or heard by someone, happens to be himself.
Right.
but it's very validating, and that's really what a lot of movement therapy is. It's about meeting somebody in their body so that we can mirror what's going on, but also providing a space for people to feel like they can be seen and be heard.
After Kelly saw that, she says, "So that's what good dancing looks like," and she was referencing me, no doubt. Yeah.
And the partners were so in tune with each other. That doesn't usually happen.
Exactly.
Yeah. They were real in step. Along with that same video, I got a kick out of. The guy was giving a toast to the mirrors, and it was like this triangular mirror, and oh boy, we've had fun.
I have to say, people are getting very creative, and
Yes, they are.
Yes.
it's like a catch-22. It's unfortunate that it took this pandemic for people to tap into their creativity. However, it's really wonderful to see people tapping into their creativity, and creativity is such a big part of who we are. And yet, as we age, even though it increases, we don't tap into it. We leave it for the kids or for the creatives who are professionals in it. But it's so important that we laugh, we play, we create art, we create music. It doesn't matter if you have a knack or a talent for it. You have to express yourself. And these are all ways we used to do that before, formal language became the thing. Yeah. So it's great. Like, I watch these videos and I just think, wow, we are such a creative society. I hope people continue to do that even after we're released back into the world, so to speak.
Yeah.
I'm going to miss these videos, though. People stop doing quarantine videos.
I know. I'm going to miss all the parodies. Those have been great.
Yeah, then my other favorite is this guy that's sitting in the living room reading a book, and you hear his child call from a distance, and next thing you know, he's putting this mirror up that looks like the couch, so he's like,
oh, I saw that one too. Yeah,
the couch.
Brilliant.
Oh boy, I tell you what. Yeah, we're gonna miss those, but probably now go back to doing something else like cat videos.
Right.
Yeah.
Oh gosh.
Well, Erica, listen, we really enjoyed this, knowing, what and also the challenges. It's real, it's you personally have been challenged, and your organization that your dream is kind of slowed down, not to a total stop, but that it's.
But when we do get back, I need to know how would people get in contact with you or to find out more about being able to do this once this is all over.
Sure. I mean, I think people just need to know that there are different alternatives, right? You can just type in the word psychotherapy and, we know so many therapists pop up. But in this creative time, if you've noticed that there's an art form that's really speaking to you, put that before the word therapy. So if music has been your solace, type in music therapy. If movement and dance has really helped you, put in dance therapy. That's actually the number one way people find us, is just typing in Chicago dance therapy. And lo and behold, our company popped up. Yeah. That was for a reason. Yeah. But other, people can also visit our website, chicagodancetherapy.com. If you just type in Erica Hornthal or dance therapy Erica Hornthal, there are lots of great videos that will pop up just to give you an idea of maybe what it looks like, more about what it could be or how to engage in the therapy. And then, email and phone is probably the best way to contact us, and that is all available online.
Yeah. There's going to be links to your Facebook, and I'll add your website on as well, so people can contact you that way as well.
Great.
Boy, this has been very informative.
Yes.
So this has been great. And Erica, I tell you what, we wish you the best of health, and we hope you get through this thing. And along with the rest of our listeners, if you're listening out there, boy, I tell you, you're in our hearts. It's not an easy way to go through, but we're all in this together.
We are.
Yeah, thank you so much. And you had reached out to me before this pandemic, and so I thank you for your interest in our field, and if and when you would like to partake in it, just call me, no problem.
Are you thinking about offering therapy for Kelly and myself?
Hey, absolutely. You don't have to be a dancer. You don't.
No.
It's not about dancing. Just moving. You
Because
guys are
Kelly
very
often
very
says,
creative, expressive people, and you yourselves literally just moved, right? You moved your
well,
show.
we're in the
Exactly.
process of.
So
We're in
you
the
proved right there. You can move.
Yeah,
Right.
yeah, yeah. Because Kelly often says that what I do is not dancing; it's something else. So yeah,
Yeah, I'm not sure what it is, but it's movement.
It's okay.
It's
It's okay.
movement. Yes.
Yeah. It's
So
not about what it looks. It's about how it feels.
How
that's
So
it
right.
feels. Exactly.
Yeah. Well,
Joyful movement.
with
yes.
that, we'll wrap up the show. Erica, thank you so much
Thank
for
you
joining
so
us today.
much.
Thanks.
This
Take
has been
care. You stay well.
enjoyable. You
Thanks, you
too.
too.
And with that, we'll say goodbye for now.
Bye,
Bye.
everybody.
This episode of The Bill and Callie Show is brought to you by Sip Coffee House 2 in Highland, Indiana on Jewett Avenue. Great coffee, lattes, smoothies, and more. Food and treats you will adore. Small town charm with big city selection. It's Sip Coffee House 2. If it's breakfast, brunch, or lunch you need, Les Café is the place to go, indeed. Open 6 a.m. to 4 p.m. 7 days a week. Les Café Pancake House, located in Highland, Indiana on Highway Avenue. Les Café, where less is more. Promise You Art House, a fun and vibrant place for local artisans to display and sell their creative works, owned and operated by artists for artists. Conveniently located at 8830 Kennedy Avenue in Highland, Indiana. For hours and events, visit pyarthouse.com or follow them on Facebook. Promise You Art House, where creativity reigns.